The doctor who did your hair transplant might not even be a doctor. And the worst part, most patients never even find this out. I'm not telling this to scare you, but I have been in this industry long enough to know what goes behind the closed doors. And I believe that you deserve to know it too. After Turkey, India is the largest hair transplant market in the world, performing nearly 3 lakh procedures every year. And with that kind of demand and lack of qualified doctors performing the procedure, this unregulated market has become exploitative in its practices. The scams have become sophisticated more than the procedure itself. So today, I'm going to walk you through the industry insights, giving you a sneak peek into what's happening and the red flags you absolutely need to address while making this decision for yourself. Hi, I'm Dr. Vandana Verma, a hair transplant surgeon myself, and I believe that if you are trusting someone with your face, your hair, and your identity, then you deserve to know this. Let's start with the first thing most of you encounter, the price quote. A lot of patients come to me for consultation after visiting multiple clinics, and almost every time the conversation starts with one concern. Doctor, the other clinics told me I need 6,000 grafts and you are saying 3,000. Why so little and why are they charging so less? And I understand why that creates doubt. Because as a patient, you are thinking that more grafts is equal to better results. But that's not how it works. Let me explain. A hair graft is a naturally occurring group of hair follicles taken from the donor area and transplanted onto the recipient area. One graft can contain anywhere from 1, 2, 3 or 4 hair follicles. So when a clinic A tells you 3,000 grafts and clinic B says 6,000 follicles, they may be describing the same result. But because the units are different, it creates confusion. And sometimes that confusion is used to make it look like as if you're getting more for less or to justify the higher pricing. So before you compare both the clinics, ask yourself, are they quoting in grafts or follicles? Because if you don't understand the unit, you can't judge the value. Now this one genuinely concerns me. You paid for a senior surgeon, you trusted a name on a brochure, you walked into the OT and then you were made to lie with your face down. And after that, a technician performed your surgery. This is called as a ghost surgery. It is illegal. But unfortunately, it is not rare. Let's be very clear about the law. According to the National Medical Council, a hair transplant is a surgical procedure and it must be performed only by a qualified registered medical practitioner. That means preferably a dermatologist with MD or DNB or a plastic surgeon with MCH or DNB degree. Technicians can assist but only under direct supervision. They are not allowed to perform any step that involves incision into the skin, which means in a properly conducted hair transplant surgery, the surgeon should be the one administrating the local anesthesia, performing the extraction, and making the recipient site incisions for designing. These are not assistant level tasks. These are core surgical steps. If these are being delegated, you are not getting a doctor-led procedure. And yet, a large part of industry operates in this grey zone. ISHRS consensus suggests that 60 to 70% of hair transplant practice is still unregulated, which means in many clinics today, the person extracting and implanting your grafts may not be the doctor you trusted. One of the most common questions I get is, what is the difference between FUE and DHI? And more importantly, is DHI actually superior? Let me explain this clearly. FUE is follicular unit extraction. It is a technique where individual grafts are extracted from the donor area and then implanted onto the recipient area. This is the most commonly used technique globally. Whereas DHI, direct hair implantation. In this, the extraction is still done using FUE. The difference is only in the implantation method, where the surgeon uses the CHOI implanters, often without the prior incisions. So DHI is not a different technique, but it is a variation of implantation. Now coming to the real question, is DHI superior? Not necessarily. Both the techniques can give you excellent results, but both can give poor results as well. because the outcome depends far less on the technique and more on who is performing the procedure and the setup they are working in. So both the techniques are absolutely valid. The real decision should be, what is the most suitable approach for my hair loss pattern, donor capacity and long-term plan? Because the best results, they come from the customization and not marketing. Now a big question. Can hair transplant cause death? The honest answer is, a properly performed hair transplant is a very safe procedure. But like any other surgical procedure, it is not completely risk-free. Over the past few years, there have been multiple reported cases in India where patients have died following hair transplant procedures. And naturally, this has become one of the biggest fears for patients considering the surgery. But it's important to understand this clearly. These deaths are not because of the transplant itself. They're usually linked to improper administration of anesthesia, untrained or unqualified personnel, lack of emergency medical support. In other words, these are absolute failures of safety standards, not the procedure itself. A hair transplant, when performed by a qualified doctor in a proper medical setup with correct monitoring, is absolutely considered safe with an extremely low risk of serious complications. So the real question is not, is hair transplant dangerous? The real question is the place that I am choosing safe enough to perform the surgery? And this brings me to the part that disturbs me the most. There are clinics in India listed on Google Maps with 4.5 to 4.8 star ratings and hundreds of reviews, offering full hair transplants as low as 30,000 rupees. Now think about that for a second. A surgical procedure at that price? That price point is only possible if the corners are being cut, which could mean compromised sterilization, unqualified or unsupervised staff, no anesthesia support, and no emergency protocol. And those reviews, not all of them are real. Studies on digital platforms in India have shown that fake reviews can be bought for a few hundred to couple of thousand rupees each. So a high rating does not always mean high standards. These are not hidden clinics. They are very much visible, they are accessible, and people walk into them every single day, trusting a rating instead of verifying the system. Here's what I want you to take away. Hair transplants do work. When done right, by a qualified doctor, in a proper medical facility, with honest planning and pricing, the results can be genuinely life-changing. I have seen it, I have done it. The procedure is not a problem. The industry around it is. So before you spend 1 lakh on your hair, spend 10 minutes verifying your doctor. I have added a checklist in the description below. Use it, share it. Send it to someone who's considering this, because the best outcome starts with one informed decision. I'll see you in the next one.